right, we are at a FitDoc workout series, and we have one of my patients, Miss Abby. And so this young lady went through the Corset Contour, and we're gonna go through her 3-month workout. We're getting back to full life. We're gonna be doing the training, and I wanna kind of show you guys like what to expect at 3 months. And we're gonna kind of get her experience going through the procedure, as well as getting back into normal life activities, and just everything about training. And that's what it's all about, is getting a smaller waistline, getting that snatched waist. It's a natural look, it's stable, and then we're gonna get her back into normal routine of exercising. So let's go get started. Okay, we're gonna get started with a little bit of a warm up. So I'm a big fan of doing a little bit of cardio, getting the blood moving, getting it started. And so, as I've said before, this is Abby. And Abby's one of my patients, and we did the Corset Contour with her. She's 3 months out, and so today is the day I wanted to go through a workout at a 3-month mark, which is pretty much you're done with the recovery, and she should get back on the normal life activities. So, thanks for coming.
Yes, thank you for having me.
Yeah.
I'm excited.
Yeah, so we're gonna do a little bit today of just kind of a little bit of everything. We'll do a little bit of maybe some arms, a little bit of shoulders, maybe some leg stuff, kind of a whole circuit kind of thing. There's gonna be some exercises I'm gonna have you kind of focus on, and then there's gonna be a couple I'm gonna try to tell you probably not to do for like maybe another month or so, to start stressing it. But so 3 months, did it go by fast, or what do you think?
Yes and no. Now that I look back, yes,
yeah,
it was quick, but during the 3 months, it was like, oh my God.
Yeah, yeah.
Yes.
Yeah. Did so what as far as working? I know you have a very physical job. How was that going back to work?
I did go back to work a little bit sooner than I should have, so it kind of hurt. It hurt.
Yeah, kind of sore.
Very sore, yes, but I got through it. I just kind of limited what I did at work, but I got through it.
Yeah.
Thankfully, without any painkillers. I don't like taking painkillers.
Yeah, most people don't. Did the corset I have you in, that one that I've kind of shown you, the one with the straps and everything like that, you're the first one that showed me that you could do it by yourself.
Yes.
You're like, watch this, and you're like, wow, and you just did it. I'm like, holy crap, I didn't know you could do that. I thought you needed 2 people.
I guess once you got to just visualize what you're looking at.
Yeah.
And then I had to cut the strings shorter too.
Yeah.
So that helped me kind of see what I was doing, and I just had to visualize it again from the back, if you will. At first, I did use a mirror. So once I kind of got a hang of that, it was like nothing to put it on and off.
Nice.
Yeah.
That's a good pro tip.
Yes.
I told Corey that you're able to do that. She's like, I don't even know how I could do that. There's no way I could do that. That's what she said.
You got to feel for the laces. That helped.
How did you feel in that corset? Did you find it mostly comfortable, fairly tolerable, or how did you feel about it?
It was tolerable, but I guess that's in your mind.
Yeah.
It did kind of dig into my skin. So maybe if whoever can't tolerate it that much, to have some type of fabric so it doesn't dig into your skin. I did have to put Band-Aids because I was actually getting like a rash right on my waist.
Right.
Other than that, it was pretty tolerable. Again, I would have to adjust the straps because it would be too tight up top. And I couldn't breathe right. So I'd have to adjust that, and that helped me also practice with the laces.
I was just so impressed you were able to do that, because I watched Corey try to do it. She just couldn't do it. It was pretty funny. Yeah.
It took some time, but I got it done. I had to. I had no choice sometimes.
Yeah. So let's talk about where you started. You started, one of the reasons women are looking for this, and it's why I think it's so powerful, is that, women who wear a lot of waist trainers and are trying to get their waist smaller, it's just a futile effort, because those the lower ribs, which are the 11th to 12th rib, are called abdominal ribs, and they're not connected to the thoracic cage. And so those are the ones that determine your waistline. And so some women are just built a little more straight, right? And it has everything to do with your skeletal anatomy, which is these ribs.
Right.
And so the idea is this procedure can basically reshape them and reset them. So making a small little nick in the back of them, then we can kind of bend them in, and then now you have a smaller natural waistline that's still stable, and it gives you that kind of that waist trainer effect permanently. Right. So that was one of the reasons you came, and you wanted to find something that we can kind of accentuate more of a waistline curve, right? And so I think this was a great procedure. You're lean enough, right? Very petite frame. It's not, the one thing that I don't offer this to patients who have like a lot of intra-abdominal fat. Like if you have a lot of intra-abdominal fat, it's not going to do anything for you.
Right.
It's just because you squeeze your side from the side and everything goes out the front, and then you kind of get a poochy abdomen, which doesn't make any sense. So this is one of those procedures you need to be a little bit leaner, right? And to get the best effect of it. The leaner you are, the more accentuated you can make it.
Right.
So I think when you started, I forget what you started at. Do you remember? Your waist, yeah.
I think it was like at 25 and a half, 26.
Yeah.
Now I'm at 22, 23. So
there you go.
Very drastic. I think any little change on me, since I'm so small, is drastic.
You're so petite, and it's so powerful. Especially when I've seen you on social media posting some of your pictures, like just your front view. That in itself is pretty impressive.
Right.
But I think the side quarter view, that's when I really start kind of seeing that silhouette kind of come in. It's really neat to see you kind of reshaped. It looks really cool.
Oh, I'm excited.
Yeah.
Every time when I went to Hawaii, I was just like, I'm wearing this swimsuit, this swimsuit, this swimsuit. It was really exciting. It felt good.
I was talking to her earlier, and I was like, do you have this waist trainer? It was a 2XS. And she goes, no, I have a 3XS. I was like, holy crap, I didn't know they made them that small.
Yeah.
And she like went beyond my limits.
I
couldn't believe it how small her waist is now. So anyway, you feel warm?
I'm good, yes.
Let's go hop on some equipment real quick.
Okay.
It's been 3 months now. How do your legs feel? Or sort of kind of get your
my legs
toe
feel
back?
great, actually.
Yeah.
Once I started getting the green light to start doing these machines, I was doing them like 3 times a week.
Nice.
Yes.
Nice.
Because I really love working out my legs. So
yeah, you have great legs.
It's light. Thank you.
Yeah. So we kind of went over during your recovery. We kind of went over your protocol when to start doing certain training. Do you remember when we got your legs going?
I want to say it was at like 6 weeks.
It was about the 2-month mark.
Right.
Yeah, 2 months mark we started doing the leg stuff, and so remember we talked about like not doing a whole lot of core stuff. We want to kind of still give the time for the bones to kind of fully heal. It takes 3 months for bones to heal. For those of you who don't know that.
Oh yeah, and when I did start doing this light work, I definitely felt it back here. So I would just do it as tolerated, where it didn't hurt, or where I wouldn't feel it.
Correct.
So
yeah, my athletes specifically, they tend to have a higher sense of their body, and the ones with a lot of common sense, like this one here, like, and if it hurts, don't do it.
Right.
But it will get better with time. It's just you got to be patient with the healing process of the human body. But you've always been very consistent with your training and regimen, and I know you have common sense, so it helps me.
Oh yeah, for sure.
Good.
Yeah.
All right. Cool. Let's jump off of that, and we're gonna do some maybe some walking lunges. We'll go from here and walk that way. Okay.
Okay.
So we'll do some. Stand over there, Jason. Let's do some walking lunges real quick. There you go. So again, in 3 months, I definitely recommend that you kind of be still supported with your waist trainer. I'm a big fan of women wears waist trainer just in general for abdominal support. And I think even after this surgery, I think you would find it more comfortable for the first 6 months. But
I did legs yesterday.
what's that?
I said I did legs yesterday.
Oh, you did? I'm so sorry.
You're good.
Cool. Awesome. We're going to do kind of a circuit, so I want to kind of do a little bit of everything, okay?
Sure.
So we're going to do a little bit of some shoulder presses. So we're going to grab something that's nothing too heavy. So maybe some 8s or something like that.
8s?
Or some 5s.
I was at 30 the last time I did shoulders.
You did?
Yeah.
Well, we're gonna kind of let's do like 8s or 10s.
These are 10s here.
So what I'm gonna have you do is I'm gonna show you real quick. I'm gonna have you do something with some dumbbells. So it's gonna be kind of a whole shoulder kind of a thing, okay?
Okay.
So we're gonna do one to the front. You can go to the side like this, one at a time, or you can do both at the same time, okay? And then you're gonna do 10 like that per arm.
Okay.
And then we're gonna do 10 to the side like this. So just up to the side, nice and slow. This is not good. And if you're doing this, you're not doing the right job.
Right.
So bodybuilding is all about control. So we're gonna come to the side like that. And then we're gonna do 10 like that. And the next one is you're gonna do 20 like this. So we're not arms to the center like this. I want arms straight up like this, okay?
Okay.
So you're gonna do 20. This is gonna be the finisher, and we're gonna do 1 round like that, okay? And this is the shoulder stuff.
Sitting down or standing up?
It's really up to you. I would recommend that you try to do these typically in a sitting position. Kind of takes your core and your legs out of the situation.
Okay.
Okay. So the front ones are kind of as you feel taller. If you do it together, that's fine. If you want to do it one on one, it's fine too. I tell people all the time that you don't need a lot of weight to get a good flow in your arm and your shoulders real quick and get a pump real fast. Really minimal amount of weight. It's more about slow, controlled exercising. And for women especially, you just got to be careful with your shoulders. So you want to go, no jerky movements, nice and controlled. No ego here. It's all about just keeping your tempo, and the quality of the contraction is nice and controlled. No jerking. Jerking with shoulders is bad. Starting to burn yet? You can do this with 15, do you think? Mm-hmm. Really? Oh, that's real
Probably
strong.
not straight through, but
Yeah.
I lost count.
So with these, you want to, this whole round is 3 sets of basically total 40 reps. You want to be burning real bad around the 15 mark for that one right there.
Yeah.
So it's a good sweet spot. Has a lot of blood flow into your shoulders, in the front, and your side heads. Mm-hmm. Good.
Good.
All right, let's put that down. And then here, what we're going to do here is we're going to do kind of like a row. So I'm going to have you use this 20 here. Okay, so what I want you to have you do is you're going to stabilize your legs here like this, your feet together. Nice, good, stable core. Arms to the front. You're going to put your weight in here in the front. And all you're going to do is pull your weight, not here, it's here, this way, okay? So you see I'm pulling it to my hip.
Right.
Okay? And what this is going to do is help, with your latissimus dorsi, is going to help with your teres major, which is kind of one of your mid shoulder stabilizers. So this is not something you need to be jerking. If you're doing this and you're twisting your whole body, you need to drop your weight. You're doing it wrong. Okay? It doesn't take a whole lot of weight actually. So just a nice, good squeeze from here, and then put your hand in your pocket. So this is kind of the movement. This to this. Okay? You really shouldn't feel a whole lot of twisting in your core. You shouldn't feel it in your shoulders. If you're shrugging, you're doing this. You see what I'm saying? Mm-hmm. So again, it's a very low. It's called a low row. Kind of hand in your pocket, just like this. Okay? Do 10%. So put your feet together. Good, just like that. Yep. There you go. And you should feel it squeeze right there. Yeah? You feel it?
Oh yeah.
So these movements you really need to focus on feeling where you should feel it. And if you're feeling up here, you're shrugging. You should feel it right there. Squeeze right there. Good? And again, it doesn't take a whole lot of weight, right?
No.
Good. Let's do 10 reps and we'll go to the other side. How's it feel?
Good.
Yeah?
Oh yes. Feels real good.
Big thing is you're doing a great job supporting yourself here, and you're keeping your back nice and straight. You're keeping your core nice and tight. Core's tight. Good posture. You're getting great arc. That arc is perfect. Keeping your weight right over your hips, which is perfect. This is the perfect posture. Just keep this up. You can do 5 sets of this, and you'll have a great back workout here.
Good.
Okay? Mm-hmm. All right, let's drop that right there. Yep. I've never seen 3XS. I've never seen it.
I got it when I was on prep. I said, one day I'll fit into this. I love it.
I mean, I could almost probably put my hands around you. Oh my gosh, I can't believe that. I can almost touch. It's crazy. It's so small. Amazing. Just wait, and if you ever get back in the prep, you're going to get, you might be like 4X.
Well, I'm still in the first row, so.
Oh, you'll probably get to the third row.
To the third row, yeah.
Yeah.
It's still the first row.
Once you get in prep, you'll be at third row for sure. And then there's nothing more.
No, and this is that I'm at the weight where I was at a regular extra small.
Really?
Yeah, so I'm still at like 112, 113. So when I
But you came down 2 sizes,
right,
basically.
Right, so when I did fit this waist trainer, I was at 98 pounds. 98 pounds, so
wow.
15 pounds.
Wow,
yeah.
That's amazing. Awesome. Let's do some rear shoulders. We're gonna do just one round of everything basically.
Okay.
And so this is a cool exercise I like to do for rear delts. So it's that little muscle right here. It's right that one. And so what we're gonna do here is we're gonna kind of cross your hands like this. And then what we're gonna do is we're gonna kind of do little pulses like this. Okay, it's just kind of like this. And then you're gonna do 10 big ones like this. So that's 1.
Okay.
So all the way down. And then all the way up. You see the motion? So that's 1. And then you're gonna do 10 of these, okay? And so what that does, it kind of helps, it changes the tension of the fibers of your rear delts, and you really start kind of feeling a burn here in a little bit, okay? So it's really just kind of tend to kind of get to feel the tension, and then you're gonna do the big ones, okay?
Gotcha.
Ready to try it?
Yes.
Okay.
Learn something new every day. These are new. And I'm leaning forward or leaning back?
Nice and straight. There you go. A little bit more standing straight up. There you go. So the big thing is this: you want to keep your hands forward, all the way forward, and then to there. Do you feel the tension different? It's right there. Mm-hmm. So this is where you're going to feel. Go ahead. Do 10. There you go. So I feel it working. Do you feel it working?
Yes.
So the idea is to kind of get them ready, and then once you get your 10, you're going to do 10 big ones like this.
10. So up.
Big, down, big, up. Big, down, down, and up.
Yeah, I love it.
Big, there you go. Big circles. Feel it?
I'm already shaking.
Yeah. This is a great exercise for the rear delts. It really kind of helps stimulate all the muscle fibers, and it has no other help. There is no helping your rear delts here. You don't need a whole lot of weight. There's no ego in this one. Just a little weight actually kind of does a really good job. Good. How's it feel?
Oh yeah. I even lost count focusing on.
This is your last one actually,
okay.
That one. Yeah. Good. Nice.
Ooh, yeah.
Well, that's a new one that you should take home and incorporate into your routine every once in a while. You don't want to do this every week or anything like that. Just kind of throw it in. It's another new one to kind of help get your rear delts going. Okay?
Oh yeah, I felt that one.
This is a common machine that we see in a lot of the gyms in like buildings and in apartments. It's a very safe version of a leg press. For most people, it's pretty easy. But I think you can increase the complexity by doing one leg. So, what you can do is, I think I did this right. Is basically what you can do is just do one leg. You stagger your feet like this, and then you can really focus more on the weight on one leg, and you'll feel a little bit better kind of mind muscle contraction to that leg. And it should be mostly for you. It should be mostly in kind of your hamstring and kind of your glute. Okay. You really shouldn't have a whole lot of core tension when you do this exercise. If you're really bearing down, you're not doing it right.
Okay.
Okay, because that's why you have this thing here, and that's why the angle is at what it's at. is really to kind of focus most of the weight, take the weight off your back and your low back and your core, and that way you can kind of focus on your legs, okay?
Okay.
So let's try that. You're pretty flexible, so you'll be able to get down pretty low.
I think I might need it at this lowest setting, my short legs.
I think that's the setting, right?
Right, that's the lowest.
Yeah. Is it?
That's it.
Yeah. Oh, one more. There you go. Good. So the working leg is obviously going to be this one, the one in the front.
Right, the top one.
The more you put your foot back here,
Lower?
Abby, the more you get more quad.
Okay.
The higher you put your foot, the more hamstring and glutes. So you can start kind of playing with angles and foot position, and it really changes the tension on what muscles you're trying to work more. Does that make sense?
Yes.
Do you feel the difference between your foot up there?
Yeah, I did feel it more on my quad when it was lower.
Good. We'll just do like 15 per leg. I know you did legs the other day, so I don't want to kill you. How's it feeling? Feeling okay?
Oh yeah, feels good. Switch.
Doc, would you say the corset contour? What type of women would you say the corset contour is for?
I think I think this is going to be one of those revolutionary surgeries here coming up, even more popular here in the next 3 or 4 years, because I think the days of the BBL is kind of waning out. This over exaggerated hips and butt to kind of recreate an hourglass shape. I think it's kind of fading out. With the corset contour, I'm able to give you more of a curvier silhouette without this over-exaggeration of fat transfer to the butt and hips. You can, for women who are very straight, we're trying to overcompensate by putting more fat in the hips and kind of give that hourglass shape. But with the corset contour, you can stay leaner, more athletic, and then just restructure the problem, which is the abdominal ribs. We just reset those, and then now we have a naturally much more hourglass shape for women who are just naturally just very straight. Well, that's her. I mean, look at her shape. I mean, come on. It's crazy. Yeah, pretty cool.
Oh, yes.
Perfect candidate. So she's lean, she's very active. You know, when she came to me, she was like, I'm trying to feel more curvy. And I think we talked about breast surgery, right? That's kind of what
We did. I even toyed with going bigger, correct.
To kind of get that illusion of a small waist. But really, the underlying issue is that we can anatomically change the structure and then reset it. So it worked out great, and so super happy with how you came out. You're amazing.
I'm happy with the results too.
I'm glad you did it. Thanks for trusting me. You know, it's one of the first sets of patients I've ever done, and it's not that I can't do it. I know how to do it. It's just kind of getting patients to believe in me and trust the process. I know I can do what I can do, and I know we can give you a safe result, and it's going to be a game-changing silhouette, permanent silhouette forever. Right?
Yeah. No, it already is game-changing.
I know, right?
So living proof right here.
Just wait until she gets on stage.
That's another thing.
Holy smokes.
That'll be way different.
It changes everything, and it's all you. It's 100% you. It's just we just adjusted one of the anatomical, structures of you in a better way.
Right.
Yeah.
That's
pretty cool,
true.
huh?
Yes.
Cool. Let's do some hamstrings real quick on a machine. This is probably one of my favorite machines. It's called the leg curl. And this is called a lying leg curl. So what it really does, the best way I can describe this is it really isolates the hamstrings in a much better way. And so they have a seated version where you curl like that. I think there's a natural tendency to cheat by kind of using your body. This one it's really hard to cheat. So I love this one. Do you use this one a lot?
Yes, I do.
Perfect. So hopefully this fits you. So you're so petite, but I think you should be okay with that.
I think it'll be good. That's good.
Key thing with this, I'm sure you know this, but the key thing is not lifting your hips, okay? So we want to keep your hips nice and planted, and you don't pick your butt up. So the idea is we want constant tension on your hamstrings, and you feel tension all the way to the bottom, and you're curling all the way to the top just like you're doing. So you're doing it perfect. You should feel a whole lot of tension. If you're really holding on with your shoulders and your hands, then you need to drop your weight. You shouldn't have to be supporting the exercise by compensating by pulling too hard or picking your hips up. Does that make sense? But that looks really good. Do you feel the tension?
Oh yeah, hands are tight.
We're doing straight sets right now, but there's different varieties of these machines. You can change the tempo. You can do drop sets. You can do hold sets. You can do high volume sets. You should try to change up a little bit. So those are all kind of I call intensifiers, by modifying a standard movement and just really intensifying the intensity of the pain, basically, in a good way.
Right.
Cool. Awesome. Let's do one more round of this, and then we're going to be done. Okay, that should be a pretty decent circuit. So I'm going to do a little bit of an intensifier with you here, okay?
Okay.
So what I'm going to have you do is you're going to pick up, and I'm going to push you down. Okay, so you're going to resist. All right, so we're going to do 5 of these. Okay, up. Good.
For the knees, the old knees.
Good. And this is called an intensifier, so having a workout partner do this with you is a lot more fun. Good, and then now you're going to do 10 by yourself. Nice.
Good burn.
Yeah?
Oh yeah.
Good. All right, we're gonna get the shoulder things up again. Let's do those 8s again. This is a very common gym that I would say a lot of hotels will have. Very similar equipment, very safe, rubberized. You can get a great workout, which I'm demonstrating with you right now, with very minimal equipment, right? So, we can modify this into different varieties. You can combine that with maybe some lunges or squats or anything like that. But 30 minutes is all you really need to get a great workout in. Oh, Chase, man, looking at her waist here is just out of control. Like, it's super impressive. I have a question for you. Did I oversell or undersell the pain?
Oversell, I believe. But then again, I have a high tolerance.
Yeah.
Than more others.
Yeah.
So I think just the baseline you set for the pain scale is good for anybody.
Yeah.
I believe so.
The more I've done this, I find that that's become very consistent. It's always, I oversell it. I mean, I do that for a purpose, but I think my average right now for patients taking the narcotic pain medicines is about almost 4 days.
Right.
So,
yeah.
And I think you're like 3 or 4 days, something like that. So it's been very consistent, which, I tell other physicians who ask me like, my experience with it. I'm like, they're taking pain meds for like 3 weeks. I'm like, no, they're not. It's just, you don't have to be. It's just, I think the keys to success for pain-free recovery is the right pain protocol, like we did, right? Surgical technique is a very big deal, in my opinion. And then also just, counseling your patients on the recovery and what they can and cannot do. And then the corset's like the #1 thing. Like, if you can get in that corset and you stay supported it's going to help support the healing process and keep you more stable.
And in my opinion, it also supported the pain.
Yeah.
Being snatched tight
Right.
helped, because when I would take a shower and I had to take it off, I felt like, oh my God, anything I do is going to hurt.
Right, right.
So having that on
Very
there
much
just
so.
felt more secure, and I could do a little bit more.
Absolutely. Like I tell patients, it's you know, it's kind of bone surgery, and it is, the corset is a cast. Like, you gotta accept it. It's a cast. All bone surgery, and if you break a bone, you're gonna be in a cast for 3 months. So it's the same concept. It maintains the stability, decreases pain. Okay, let's get those lats working again. Again, try to keep it, don't rotate your back, just pull back, straight back. There you go. Hand in your pocket. Perfect. Good job. I'm not sure how long your workouts are, but usually 3 or 4 sets per exercise. You can do like 4 exercises, and that should be about 30 to 40 minutes. If you just take your time, and you know, as you notice, you're not sweating profusely. You don't need to sweat profusely to get a great workout, get good muscle activation. Well done. Awesome.
I'm liking these.
These are my favorites. Good. You want to keep bringing it. There you go. Let's do the little short ones here first. There you go. A little bit higher. Hands higher. There you go. Yep, just like that. So the reason we do 10 here is to kind of start pre-fatiguing your rear delts first before the work. The work is going to be the 10 working sets, and that's where we're going to be really working. Nice. Good. Nice big circles all the way down. Good. Nice. Great posture. Feet are nice and stable behind you. Your angles are good of your back. Just all you gotta do is repeat this. You do this, you do 4 sets of this, your rear delts are gonna be
Oh yeah, they're already on
sore
fire.
tomorrow. I promise you, so sore tomorrow if you do 4 sets of this. But this is a good introduction to start kind of getting the feel for it, and I think you'll start liking it. It'll be one of probably your favorite exercises, I'm anticipating. Starting to burn.
Oh yeah.
I can see it. There's the variations, those should show you, so the people at home watching this, and then if you try it and it's too hard, then you can always do this with bands. So you'll take one of these and you grab another one if you have it, right? And it's the same thing, right? So you can kind of do this, right? The same thing, just use 2 bands. It's a little bit easier for women who are not bodybuilders or used to training with weights. It's a great kind of introduction movement, but you start feeling it. You know, you're obviously a little bit stronger, so. But as I've proven to you, it's pretty uncomfortable pretty quickly.
It is. It is. I felt it after that 5th rep.
Yeah. Cool. Let's hop on up here and let's finish this up.
Alrighty.
So we're gonna do some intensifiers here, okay?
Okay.
So same thing like we did with the quads. We're gonna come up, and then you're gonna hold. Try to slow it down. Don't let me pull you down. Good. All right, up. Try to slow it down, okay? Nice and slow. Up. Good. Up. Good job. All the way down. Squeeze. Good. All right, now you're gonna do 10 by yourself. Good. Nice and controlled, no jerky, all the way down. Again, focus on your hips, keeping your hips down. Nice. Around rep 7, it started kind of burning, yeah? You're getting there. Good job. Nice and controlled. It's all about quality versus quantity. You're doing great. Good. Good job.
Was that 10? I lost count. I was focusing on my... Whew.
Well, that's it. High five. Nice
Five.
workout. It was
That's
about
good.
30 minutes for all that, so we kind of showed you some new stuff you've never done before.
Yes, I was going to say that. You learn something new every day.
Yeah,
That
so
was
we
good.
kind of went through a little bit of everything, a little kind of total body thing. Again, 30 45 minutes for most people is a great workout. So not playing on your phone. Yeah, working out. But I'm just so proud of you.
Thank you.
Again, thank you for trusting the process and trusting me as your surgeon. You look freaking amazing.
Thank you. No,
I cannot wait to see you. If you go through the bodybuilding prep, like I promise you I'll be able to put my hands like this around you. I think you're gonna get that small.
I'm pretty sure I'll reach third row.
I'm almost assure you of that. So again, congratulations on making it 3 months. High five. All right.
So happy.
Well, thanks you guys for following. Please go check her out. She's very inspiring. You'll get to see her, exercising and training, and I think she's gonna be on stage sooner than you think. And for those who've never been on stage, it's really an experience. But it's been a great workout. Hope you like this content. Don't forget, give me a like, give me a subscribe, drop me a comment, please. And I love bringing this educational content to you, giving you real life experience in working out, getting back into working out after these surgeries. So thanks again for following my channel, and go follow me on Instagram and go follow Miss Abby.
Yay. Yes. My goal for 2025, because I know last year I didn't, was post a lot of content, workout content. So I'll start posting more workouts for sure now.
Go check her out. Stay tuned for the next one.
Question for you. So this first surgery first came out, it almost seemed too good to be true,
Yes.
right? It was like, oh, there's no way, right? 4 inches off your waist like that. What kind of relief and excitement did you have when you actually saw how small your waist was?
So relief was that I don't have to wear compression 24/7 anymore once I reach my 3-month mark. Also just excitement because I got the look that I was going for. And he said I would have the inches off my waist instantly. Yes, it was instant. However, I did have to recover, and the recovery went way smooth, and I'm just super excited with my results. Ladies, I know it sounds too good to be true, but trust me, it's good and it's true. Here it goes. Mind you, this is a 3X. That's it.
Side give me the full.
Living result.
Give me a pose. Body's in pose.
Oh, God, I haven't posed it forever.
I know, right?
Hey, look at that, folks.
That's the pose.
Muscle memory.